welcome back to Hudson Health. My name is Dr. Angel Lazo, and I'm with Barbara Wood Johnson, Barnabas Health. I'm your co-host, together with my colleague.
Hi, good afternoon. I'm Dr. Ije Akunyili. I am Chief Medical Officer at Jersey City Medical Center, a division of RWJ Barnabas Health. Excited to be here.
Today's segment, actually, we're going to talk about orthopedics. Big deal, big deal.
Absolutely.
Because orthopedics is related to pain and discomfort.
No pun intended. Yeah.
No pun intended. But again, we're going to be talking, actually, we're going to have a special host during this segment, Dr. Shin, who's going to be joining us. And again, he's going to be talking about a lot of the innovative things that we're doing with our WJ Barnabas Health at Jersey City Medical Center. And I'm very excited to have him on board.
Yeah, looking forward to it.
Okay, so we'll be right back with our guest.
Jersey City Medical Center is healing, enhancing, and investing in Hudson County because your heart doesn't beat just for you. So get it checked. When your bones are healthy, it lifts us all. We're delivering joy daily in our Lord Abbott Maternity Wing and providing New Jersey's only NCI-designated comprehensive cancer center. We'll continue building our medical network and taking every precaution for your safety so that we can all be healthy together.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Panapinto Properties, Jersey City, shaping the workplace with state-of-the-art office spaces and addresses your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panapintodevelopment.com. Panapinto Properties, building Jersey City for everyone.
I've got cancer.
We've got the highest level of cancer care,
the latest clinical trials,
researchers working to find a cure,
and nurse navigators to guide you every step of the way.
At New Jersey's only NCI-designated Comprehensive Cancer Center, your safety has always been our top priority.
I've got cancer, but I also have peace of mind.
Jersey City Medical Center and Rutgers Cancer Institute of New Jersey. Let's beat cancer together.
Hello and welcome back to the segment. My name is Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a branch of RWJ Barnabas Health. I'm joined today by my incredible co-host, Dr. Angel Lazo.
Thank you. Yeah, I'm Angel Lazo, internal medicine, and I'm with RWJ Barnabas Health at Exchange Place. And today we're going to be talking about orthopedics. Big deal. Ortho's a big deal.
It's a big deal for everybody, whether you're a weekend warrior, what's it called, pickleball? Mm-hmm. Yeah,
absolutely.
Pickleball, or an MMA fighter like some people we know. Whatever your lifestyle is, the goal is to keep your joints healthy, whether you're suffering from wear and tear, sports injury, arthritis, degenerative disease.
Correct.
It's everybody with the potential to benefit.
Yep, and especially at Jersey City Medical Center because we are a level 1 trauma.
Absolutely.
But again, it's not just trauma and it's not just orthopedics because it also involves spine. So it's not just regular joints. And again, our guest is going to be joining us. It's actually a specialist in spine, and he's going to be talking about a new procedure that we're actually doing and so on and so forth. I mean, for me, orthopedics is a big deal. Because again, it does affect the quality of life and so on and so forth. And again, as we age, our CD38 factor starts to kick in.
Did you say we?
Well, you'll get there. Don't worry. But it is a big deal, and especially with the pandemic, where everybody was staying home, our obesity rates are through the roof. And here's a little tidbit, obesity, yes, maybe it increases 2 to 3 times your risk for heart disease as far as hypertension and so on and so forth. But if you're obese, you have a 30-fold increase actually in having orthopedic problems.
But then it's a catch-22, right?
Absolutely.
Then if you have orthopedic problems, you're not as able to exercise.
Correct. So it becomes a little bit of a vicious cycle. That's why I'm really excited about bringing Dr. Shin in. So why don't we go to break, and let's go ahead and bring him in so he can start talking to us about some of this incredible innovative procedures that he's actually been working on.
I
and actually first in the state.
So. Can't wait.
Okay, let's bring him in. Thank you very much. We'll be right back.
Jersey City Medical Center has a passion for heart health. We're Hudson County's only full-service heart hospital. with innovative technologies and premier cardiovascular physicians. A partnership with Rutgers Health. The latest technology and medical advancements and nationally renowned care for every heart in every community. Whoever your heart beats for, our hearts beat for you. Jersey City Medical Center.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one path stop away, or a quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Hi, everyone, and welcome back to Hudson Health. My name is Dr. Angel Lazo. I'm with RWJ Barnabas Health, Internal Medicine at Exchange Place. Here is your co-host with Dr. Akunyili.
Hello, everyone. My name is Dr. Ije Akunyili. I am Chief Medical Officer at Jersey City Medical Center, a branch of RWJ Barnabas Health. And we have today our spinal surgeon.
Yep. Hi, everyone. I'm Dr. Shin. I'm a orthopedic spine surgeon at Robert Wood Johnson Barnabas Health. I'm very excited to be here today. Thanks for having me today.
Delighted to have you.
Tell us a little bit about your training. Tell us about what you do. Because again, you're orthopedic. Mm-hmm. Orthopedic surgeon. Yeah. But you're dealing with the spine.
Yeah, so I finished my orthopedic training at UMDNJ. That was for 5 years. And then I did an year of spine fellowship at NYU. And during that time, I had a chance to learn a lot of cool stuff, including the endoscopic spine surgery. Mm-hmm. And then I spent another month in Korea to learn more about it, because it's them who kind of invented and developed the whole technique.
It's fascinating. So tell us, I mean, you're obviously incredibly well trained, and we want to let our people at home know what are the signs and symptoms that would make a patient go either to their primary care doctor or to a spine surgeon. What would they notice?
So first of all, there can or can't be, the back pain doesn't have to be there, but mostly it's going to be the leg symptoms. So if you have shooting leg pain from the back, that can be a sign of herniated disc, or if you have bilateral leg pain, like crampy sensation when you walk, that can be a sign of lumbar spinal stenosis. Yeah.
Excellent. So what point do you recommend, say, for example, because I do internal medicine, so at what point should I say, you know, I can no longer deal with this, you know, I really need to get you to the next level of care, you know, I'm going to refer you to Dr. Shin. Yeah. So what does that conversation look like for me as an internal medicine doctor, from your perspective as a specialist?
For herniated disc, we give about like 6 weeks to 8 weeks for them to get better on their own, conservatively, using physical therapy or injections. And for the lumbar spinal stenosis, it's really symptom dependent. If patient can't walk as much as they want to walk, then something could be done for that.
So this is a little bit different. This is not just, you know, spine surgery per se, you know, with a neurosurgeon, so on and so forth. This is a little bit more focused. Explain that to us. In other words, what you do that would be different, say, than a neurosurgeon, for example.
So neurosurgeons and orthopedic spine surgeons, we do pretty much the same thing surgically with respect to the spine. But I think they do a little more of spine oncology. Yeah. I think that's the only difference.
But again, from my perspective, it's not just that neurosurgeons do spine surgery. I mean, orthopedics does do spine surgery, which is incredible.
Yeah. So there is a big overlap in between those two specialties.
So I'm an emergency physician. Angel here is an internal medicine doc, and we deal with a lot of patients who are very hesitant. They may have Googled something. They're worried about what would surgery do to me? Is this the right step?
Right.
Who should I see? What would you tell those patients? What are the absolute indications, and when can surgery be prevented?
So the absolute indications would be if you have any frank weakness in your legs, in any of the muscle groups, and if there's pain that's so debilitating you can't even walk, then I think those comprise the absolute indications, in my opinion. And also, since you work in the ED, you must be seeing a lot of different pathologies, such as like spine oncology, spine like abscess, and those are also absolute indications. For spine surgery.
Absolutely.
So tell us a little bit, what is this unilateral bipolar endoscopic procedure that you do? I mean, is that robotic? Is that AI? Explain a little bit about what that is.
Oh,
that's a new one.
Yeah, I want you to say slowly for the people at home.
Okay, so it's relatively new.
Right.
The first of its kind was done in the States in 2019, and on the East Coast, in New York, I think the first one was done in 2022. So it's unilateral bipolar endoscopic surgery. Unilateral meaning that the surgery is done on one side of the patient, and bipolar meaning I make two portals, one for the camera, one for the instrument. There are very small portals, about 1 centimeter each, and then I do the surgery inside using those two holes. And endoscopic meaning I use the camera system that goes in there.
So is that less recovery time for the patient? And what are the advantages of this newest and coolest procedure?
So compared to the open surgery, I do not have to sacrifice the native tissue as much. So I just take off the soft tissue off the bone, just the right amount that I need, and then I shave off the bone minimally, and then I can do all the work that needs to be done that was going to be done with the open surgery. So basically, it's like getting the best of both worlds. Like I'm doing everything I need to do in a very minimal fashion. So the recovery time is quicker, and the patients have less postoperative pain, which translates to quicker return to work, and the pain medication use is much less, and then the total experience is much more palatable to them.
Yeah. No, especially quality of life. I mean, when you're dealing with orthopedic problems, you're dealing with pain and stiffness and so on and so forth. It's unrelenting. So it's a quality of life issue as well. Huge quality of life issue. So.
And how soon are these patients, talking of quality of life, able to return to normal functioning, exercise, etc. after this procedure?
The relief of pain from surgery, from the relief of the radicular pain from surgery, that we see almost instantly in the recovery unit. And I see them like walking around without pain. And since it's minimally invasive, the surgical site pain's like very mild. So when I see them, like they're happy in the recovery room, they're walking around, and some of them are even telling me that they have no pain. So.
And my understanding is that you're actually the first one to do this procedure actually here in the state.
Oh yeah, I was very fortunate to have been at NYU when I was training for spine surgery. That's when they started, and then I am like proud to bring it over to Jersey side.
Well, we're even prouder that you're actually part of us, RWJ Barnabas Health. So we're going to be right back with the next segment. We're going to bring Dr. Shin right back. We have a little bit more to talk to him about spine.
I've got cancer.
We've got the highest level of cancer care.
The latest clinical trials.
Researchers working to find a cure.
And nurse navigators to guide you every step of the way.
At New Jersey's only NCI-designated comprehensive cancer center, your safety has always been our top priority.
I've got cancer, but I also have peace of mind.
Jersey City Medical Center and Rutgers Cancer Institute of New Jersey. Let's beat cancer together.
Panapinto Properties, Jersey City, shaping the workplace with state-of-the-art office spaces and addresses your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panapintodevelopment.com. Panapinto Properties, building Jersey City for everyone.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets. Price to fit your budget. Installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Welcome back to this segment of Hudson Health. I'm Dr. Ije Akunyili, Chief Medical Officer at Jersey City Medical Center. And with me, my co-host.
Hi, I'm Dr. Angel Lazo, Internal Medicine with RWJ Barnabas Health. And we're joined here today with our special guest, Dr. John Shin.
Hi, I'm Dr. John Shin. I'm an orthopedic spine surgeon at Robert Wood Johnson Barnabas Health Group. I'm very excited to be here today.
So Dr. Shin, welcome back. We just had an exciting segment where you told us all about the newest innovations in back surgery and spine surgery. But I wanted to get a sense from you. Where do you see more innovations, the wave of spine surgery of the future coming? Tell us more about that.
So in my opinion, I don't have too much experience in spine surgery, but in my opinion, the way I see it, I think the endoscopic spine surgery will be a crucial part of the spine surgery in the future. Like, for example, in the past, like all the rotator cuff surgeries that many people are familiar with, they were all done open, but that's 20, 30 years ago. Wow. But now, for the shoulders, almost everything is being done arthroscopically using a small camera and a tool. I think we're seeing the similar thing in spine surgery, and I'm very excited to be a spine surgeon at this time especially because of that.
No, the technology is advancing like incredibly. I mean, this is actually very reminiscent actually of our last segment that we did, because we did the heart month with cardiology.
Correct.
And just like intervention changed cardiology, as far as open heart surgery and so on and so forth, I mean, I understand exactly what you're talking about, how this endoscopic procedure is actually going to, which is minimally invasive, is really going to change orthopedics. Yeah. So really going to change orthopedics.
And we also think, you and I have talked in this about access. Yeah. Having this procedure, not just in New York City, but available to people in this community, because healthcare doesn't travel. Right. And if you have back pain, the last thing you want to do is drive for a long while. So tell us more about how you see this being also an access issue, that we can not only have all these innovations, but have them here in Hudson County.
I think it's exciting. People don't have to travel to different states to get this procedure done. They can get this done in Jersey. And I'm like working with the residents right now, since it's a teaching hospital, and I'm showing them how to do it, and I'm sure they're going to carry this on forward. So I'm very excited to be a part of this.
I mean, this is a really big plus for Hudson County, having these academic practices. You yourself, for example, coming from New York, and now you're here actually in Hudson County, to serve the patients of Hudson County. That's really a big deal, Dr. Shin.
So we were going to ask this. While we're very excited and very happy about all the innovations we have, part of our role as primary care and emergency doctors is to ask about prevention. How can we prevent back pathology?
So I think the most important thing is to have a good posture, because if you have if you're like stooping forward or leaning to the side, then you put unnecessary stress at some of the joints in the spine. And also another thing is lifting with your legs, not with your back. Because when you do that, there's a very high chance of unnecessarily damaging the discs in your spine.
But again, it's just going back to the basics. It's just simple mechanics, And again, a lot of these patients have been familiar with this. They've already had the physical therapy. They may have already seen, a neurologist, a neurosurgeon. I mean, from an orthopedic perspective, to be able to do spine, especially non-invasive and in Hudson County, I think that's a huge plus. Huge.
Yeah, it's a big game changer for our population. Is there anything else you'd like to share with people at home about making sure they get care? I know we talked in the first segment, but reminding people to please see their primary care doctor or spine surgeons when they have certain symptoms.
Yeah, so if you have any back pain that's accompanied with shooting pain to the legs, or if you have any leg pain that's worse with standing and walking, and if that pain is especially crampy, then that's very likely coming from the back. But oftentimes people mistake that for like knee arthritis or hip arthritis. And they see multiple different joint surgeons, and then they end up in my office.
But I like your vision of the future, that this really is the vision of the future, the innovation. Again, in the academic practices, we talk about, evidence-based medicine. RWJ Barnabas Health practices evidence-based health management. So in order to have you as a specialty physician, an academic doctor, offering these services in Hudson County, The only thing I can say is thank you. So
And training the next generation of doctors.
I mean, the hospital's been more than supportive about this procedure. They got all the equipment I need, and then the department is very happy that I'm doing this procedure. So, yeah, I'm living the dream.
Yeah, yeah. And I hear you have a young one coming.
Oh, yeah. So next week, actually.
Oh, wow. Congratulations.
Well, congratulations to both of you.
Thank you.
This is your second
one, yeah.
Excellent. Well, thank you very much. You know, for anyone actually having a question about how to reach Dr. Shin, you can go to rwjbh.org/Hudson, and you'll be able to see all the group of doctors, including Dr. Shin, to be able to do your non-invasive, your minimally invasive endoscopic procedures. Well, thank you very much for having us. And we hope to bring you back in the near future to give us an update on the endoscopic procedures.
Absolutely. Thank you for
having
coming.
me today.
Jersey City Medical Center is healing, enhancing, and investing in Hudson County because your heart doesn't beat just for you. So get it checked. When your bones are healthy, it lifts us all. We're delivering joy daily in our Lord Abbott Maternity Wing and providing New Jersey's only NCI-designated comprehensive cancer center. We'll continue building our medical network and taking every precaution for your safety so that we can all be healthy together.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Jersey City Medical Center has a passion for heart health. We're Hudson County's only full-service heart hospital with innovative technologies and premier cardiovascular physicians. A partnership with Rutgers Health. The latest technology and medical advancements and nationally renowned care for every heart in every community. Whoever your heart beats for, our hearts beat for you. Jersey City Medical Center.
Welcome back to Hudson Health. My name is Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a branch of RWJ Barnabas Health. I'm joined today by my co-host.
Hi, I'm Dr. Angel Lazo with our Robert Wood Johnson Barnabas Health, and I'm an exchange space and internal medicine doctor. So we just had an incredible segment with Dr. Shin.
It was.
Incredible segment with Dr. Shin. Now the interesting part for me is...
We're all sitting a little straighter.
Yeah,
make
pretty
sure
much.
our postures are right, okay.
But the interesting part for me is, you know, especially as an internal medicine doctor, you know, having the ability to not just necessarily have to go straight to neurosurgery and so on and so forth, you know, to have someone that does something minimally invasive, state-of-the-art. I mean, I know RWJ Barnabas Health is big on the academic practices and so on and so forth. And again, they're big on, you know, evidence-based medicine and evidence-based health management. But this just makes sense for a lot of the patients. I mean, I do internal medicine, and I know once I told my patient, you know, I need to send you to the neurosurgeon and so on and so forth, you know, they're talking about a major surgery, a major delay. It affects their life, their quality of health. To have these kind of procedures that are innovative, it's just incredible. I honestly, I had never even heard of it. Unilateral biportal endoscopic procedure.
Me neither, but thank God it just came out last year, so we have some journal reading to catch up with. You know, as an emergency physician, I was really intrigued by that conversation because I don't get to see a lot of the elective work he was talking about. I see a lot of people with spinal compression, fractures, and really there's a big access issue about having enough spine surgeons to take care of those patients when they come in emergently, or people with chronic back pain and now they're having neurological symptoms like they can't walk or they're having weakness. So to really have that in our community and not to transfer those patients. And a lot of them, you know, we have not been to a doctor for a while, or, you know, the common theme, have ignored those symptoms, and I see them in emergency room. So I'm intrigued about having minimally invasive procedures for them and really for all patients. But don't you think the overall theme we keep hearing over and over again as we do the shows is do not ignore your symptoms?
Yeah, and keep it simple, you know,
Yes.
keep it to the simple mechanics. For example, when you're dealing with spine, you know, dealing with the simple mechanics, which he had discussed. Most of our patients already have been to the physical therapy and so on and so forth. It's just a little bit harder for me, you know, as an internal medicine doctor, when I'm talking to these individuals, my patients, about, you know, spine issues and so on and so forth. It's always kind of like a negative, like, you know, do I really want to get that done? Like, so to do it non-invasively it's endoscopically, it's just incredible. It's just incredible how the technology is advancing. But I love the fact that Robert Wood Johnson actually brings this to the table for the Hudson County residents, so that you really don't have a choice. It's more options, you know, that our WJF actually offers rather than choices. It's options. The patients can actually have significant options.
Absolutely, and no pun intended, we know healthcare doesn't travel. Back pain definitely doesn't travel.
Yep.
You don't want to sit in the car for hours and hours when you're having back pain. But I also think that, you know, I know this was a session on spine surgery, but really to think that the system has the entire gamut of physical therapy and all those things that will be adjuncts to this treatment should you need it. So you also don't have to travel for those. And
this service is actually going to be offered, especially at our new location in Hoboken. So it's going to be very comprehensive. And again, the integral part for me is the communication between the doctors. So it's not just Dr. Shin. It's all the doctors that are involved in the patient's care. It might be the neurologist, it might be myself as the internal medicine doctor, and we all use the same platform in order to communicate, you know, which is Epic, you know, so we're able to communicate amongst ourselves, not just having to pick up the phone anymore. You know, we basically send messages by computer, you know, about the care of our patients. So it's really an integrated healthcare system, and that's what we offer to the Hudson County residents as the leading hospital in Hudson County.
Absolutely, and you know, both of us are very passionate about quality of care, life quality for our patients. Absolutely. And to have a procedure where he describes people sort of wake up and they walk around and they're pain-free and they can go back to whatever made their lives meaningful. That's really, in the end, what healthcare is about, right?
No, it really is. But again, we're very fortunate to have these very young, talented academic doctors, you know, that are actually coming into the system.
I like it. You keep mentioning the academic part, but it's also training the next generation to be able to take care of our population.
And we take a lot of pride at Jersey City Medical Center, you know, that we are the leading academic institution actually in Hudson County, you know, and we're leading academically actually in the whole state of New Jersey with our academic practices. So it's very exciting. And again, we do all this for the Hudson County residents. So, well, I'm excited about our next show. I think we're going to end this segment now, and we will see you next week at our next at the same time.